the pleasure of welcoming Sylvia Martinez Cabriales from Sault Ste. Marie to talk to me today about her work in a smaller community in Ontario. Welcome.
Hi, thank you so much for having me, Real. I'm so happy to be here with you. And of course, I want to share my story. Well, I'm Sylvia Martinez, and I have been practicing in Sault Ste. Marie since 2022. I came straight from my fellowship at the University of Toronto. And since then, I have been practicing in the community. We have a catchment area of about 115,000 people.
115.
So 115,000 people. That's the covering we have from the city. Well, it's not the city, from a rural area, and from the district of Algoma. So we go north to White River, and we go east to Spanish. So the next big community, I would say, is Sudbury, which is about 4 hours by car from here. So we also
How far are you from Toronto? If someone had to go to
8 hours by car.
8 hours, yeah. Mm-hmm.
Yeah, we are lucky that we have an airport, and actually it's like 20 minutes from my house, so it's pretty convenient. Yeah. And it's a small airport, so as soon as you get there, you are easily get into the waiting room for the gate. So the flight to Toronto is about an hour.
Okay, yeah, if needed.
45, 50 minutes. Yeah.
Well, I know your backstory already a little bit, but just share what led you to land in Sault Ste. Marie as a smaller community compared to a more urban center.
Well, it was a family decision. My husband is a physician as well, and he was initially recruited to work here at the Sault area hospital. So when he came to see the community, he was really excited because the community has like a lot of outdoor activities that you can be doing. And we like to do hiking. We like to do skiing. We are trying cross country. So we found out like it was an opportunity for us as a couple and now as a family. And we are happy here.
Awesome. So focusing on your community, what is unique about working in a rural community, and how is that different for you compared to working in Toronto, the urban community where you trained?
Well, I would say like something that is unique here and actually is pretty exciting as well is that you can easily see how your work can change or can like how your actions towards like the care of people can actually change the community well-being. And I'm telling you this because I have like stories. Like I ended up seeing one patient and then I see how I'm contributing to the healthcare. And then that patient, because he's working in a nursing home or he's working in a daycare, at the end of the day, my another person that I'm working with gets benefiting from my care of those patients. So everything is like connected. Or even me, I'm benefiting because those patients at the end ended up working in the bank or in other places that we are. It's still like a small community. The Sault area population here is just 75,000 people, and I would say like kind of like at the end of the day, I'm seeing like the whole family. I ended up seeing like the children, and then I ended up seeing the aunts or the uncles, and then at the end of the day I connect everyone and I know the whole family. So you get deeper relationships with your patients, and that is pretty nice.
Yeah, there's a lot of ripples in a small community, and then after a few years you're surprised how everyone knows everyone, right?
Yes. Yeah, and then I'm seeing a patient and they say, well, I'm so lucky that I'm seeing you because my dad has had psoriasis for so long and now he's clear and I want to see what options, and they have the same condition. So then you ended up knowing like, oh, and actually you saw it like a month ago because of that. And then when you see the follow-up for the next patient, like you kind of like feel like not like a family, but you feel pretty connected with them.
Yeah, a good word of mouth in a good way, right? Yeah.
Yeah.
Well, you already mentioned this, but is there anything else particularly rewarding that you find in working in a smaller community?
Well, there is a lot of variety in terms of skin conditions that you see, and that's pretty good because when I at the beginning I thought I would be seeing mainly like general derm, and I was so wrong. I'm seeing a lot of complexity. I'm seeing a lot of skin cancer. I'm seeing a lot of melanomas, but also I'm seeing a lot of like I have seen sarcoidosis, CTCL, a lot of rashes, and a lot of severe eczemas. We have a lot of indigenous population here, so I'm seeing a lot of um, atopic dermatitis, not well controlled for sure. So it's a lot of hair loss conditions as well. So I think that because you are on your own, you are learning a lot. So you are building a lot of clinical experience, and then you are like making like your scope is like broad, right? So you are developing like a wider skill set. So it's challenging, but it's exciting.
Mhm. Yeah, there's no subspecialty clinics to send to, so it's you.
No,
That's
yes.
So what is the unique challenge though in working in a smaller community? What's harder?
Well, something that you just mentioned, like it's like you are on your own, and then the other thing, like kind of like the other specialties, it's not like you have a lot of options. So it's like only one dermatology, which is me. Well, we have locums though, which I'm so grateful. Right now there is two locums. One that is actually filling for me because I'm still on maternity leave, and the other one has been coming here for longer. But for instance, in the community, we have only one
Mhm.
rheumatologist here. There is one plastic surgeon. There is
Mm.
one ENT. So the challenging is like there is not a lot of people that you are going to be referring in the community. So you might need, because of that waiting, you will need to work with people outside the community, like in Sudbury or in Toronto, for instance. So you need to navigate that with your patients, try to push them to go through those because sometimes they don't want to travel.
Mm.
Um, yeah, that's for sure a challenge, and also that you need to connect with your colleagues in a way that you are need to have like a mutual um, collaboration, right? You need to be working with them. You need to support them so they also support you.
Mm. Mhm. Yes. Yeah, that's the long relationships you'll have with some of these people, and it has to be highly functional, right?
Yes.
Yeah. So, you have strong ties to Toronto, especially in complex derm, but you're quite far away now. But how do you manage complex cases in your practice?
Well, I think I have learned a lot about working with or uncertainty, and I do a lot of close follow-ups with my complex cases. If I have a challenging in terms of diagnosis, I do a referral. I have referred my patients, my complex cases when I'm really struggling with a specific thing to actually Toronto, to my mentors, and they have seen my patients and they have supported me, and I'm so blessed because of that. The other thing is we have a group that in the north, in Northern Ontario, because I have a colleague that she is working in Thunder Bay. I have a colleague, well, more colleagues that they are working in Sudbury and in Barrie. So we connect and we discuss cases.
Mm.
So we help each other as well. The other thing is like through with other friends, I've just sometimes just ask questions about or discuss the cases, and that's another helpful thing, like with your colleagues, working with them.
Yes, yeah. Always nice to have those 5 numbers in your back pocket when you need to call
Yes,
somebody. That's wonderful you've got a group. It's not common, and I haven't heard it before, that there's a group of, people working in more remote communities that get together. I think that's brilliant. It's so
yeah,
supportive.
yeah, sorry, yeah, yeah, we do it remotely. We connect like once, I think about like 4 or 5 times per year, and we support each other with cases, and yeah. to see what options you will do in a specific situation or things like that. Yeah.
So nice. So in your community, what supports do you feel are lacking or could be better developed to help you do your work easier?
Well, that's a good question. And I would say, like, I would love to have more dermatologists here with me, to have colleagues, right? Because if, I mean, I'm on my own, so there is no one next to me in the room that I can just ask them or bring them into my room to see my patient as well, to have a discussion at that time. So I think I would like to have someone else here permanently practicing. That would be great. Having more access to even plastic surgeons, because there is only one. Most surgery would be great to have here. I do have light therapy. We do have a phototherapy unit, which is great because I see a lot of eczema and psoriasis and CTCL as well.
Mhm.
What else would I would love to have? Well, I would love to have many things, but I would think like human resources would be great, like having more colleagues here, because it's isolating in a way. Like, I mean, I'm so lucky that we connect with my colleagues in the north, but I would definitely would like to have more people here working next to me.
It makes a big difference. And so, piggybacking on that question, what sort of incentives do you think would draw people and encourage people to, work in a more rural community? And I mean, the different ideas are thrown around, be they financial incentives, professional incentives, personal incentives. What do you think would draw people into your community?
Well, I don't know if they do know, but there are like financial incentives for recruitment, like, which is like about yearly for about 4 years, and then there is another one for uh, to keep you here, right? And apart from that, if you want to do research, there is plenty of opportunity to do that through the hospital, through the Sault Area Hospital, or through NOSAM, which is the Northern Ontario School of Medicine. There is also opportunity for academic. So right now I'm enrolled as in the family physician program. There's no dermatology resident, so the family physicians, they do a 2-week elective with me, and it's been great because before that they told me like they were not seeing a lot of dermatology because they were kind of like scared about it was a challenge, and they were not able to figure it out. So right now they are really enjoying the elective with me. So if a resident wants to build a career in academic, they can do it here as well.
Fantastic. So, if you were to give advice to a resident who is thinking about setting up a practice in a community like yours, what advice would you give an upcoming resident if they wanted to consider working in a rural practice?
I would say like they will need to go and visit and see the needs for the community, the needs that they are. Yeah, because if you, it is, well, honestly, first of all, you need to be sure that the life that you want to have is going to be okay in a rural area, because it's different, right? We don't have like a nightlife here. There is not a lot of restaurants. There is, compared to Toronto, when you can just order food like kind of 24/7 and go to many places and change the menu every day. So it's a different lifestyle, but I love how it is because the work balance is easier. The commuting is pretty good, like in 15 minutes, even though I'm living completely opposite to the clinic where I'm working right now. I'm 15 minutes, I'm in my house. So I would recommend that go and visit, do an elective, do a rotation to see what variety of cases they are in the community, what can you bring to the community. And if you're interested in pursuing like changing like the lives of many people, I think that it's a good idea to just go for it.
Yeah, I totally agree with you. That all resonates with me. Thank you. So, how do you have any ideas how the CDA, the Canadian Dermatology Association, could help support practitioners who work in more remote areas? Anything we could be doing better?
Well, I like a lot the mobile unit, the melanoma mobile unit that the CDA has. Like they doing, I think they do in association with the melanoma, because actually it was pretty helpful. The last time they came here, I got referrals from that because there were some basal cell carcinomas and squamous cell, and the patient, they were, oh yeah, I went to the mobile unit and I saw them and they referred me to here for the full excision, and that was pretty good. So thank you for that. I think it's really useful. I wonder if there will be, since I have already a group with the northern dermatologists, maybe we can create something like that through the whole country, so we can discuss cases, because sometimes, if I know that we can have similarities in cases in the north. With, for instance, I know with Regina and Saskatchewan, so that would be pretty good if we can just create like a different forum as well, and where we can just support each other's in management of complex cases. That would be really nice.
I agree, and you bring up Rachel. I mean, there's some people in some areas working have had really not. I mean, like we all have ideas, but there's uptake in certain parts of Canada for ideas and support. And when it works, it's so inspiring to see how it can work well with the support of this kind of a team behind you to do even better work, because the work is very complicated and very cases are complex. They require a lot of support, a lot of remote support, and then to have more team members that can help you in a model that's sustainable. It's so exciting to see how it can roll out in other parts of Canada. So sharing that information with each other creates a
Yeah,
model that we can try to template in other communities if the health authorities can support us. So yeah, I would love to see us coming together at the annual meeting or even virtually. That would be great.
yeah, I think that would be a good idea. Thank you so much for having me, Ariel.
Thank you. Thank you so much for taking time as a new mother, and enjoy the rest of your maternity leave. I'm sure we won't be seeing you at a meeting in the next 6 months, but if you do, I'd be happy to see you. But otherwise, very soon, I hope.